Today we'll be going through some exercises designed to be helpful for mobility during intercourse. It is important to bring blood flow to the pelvic and trunk muscles, as well as mobility to the joints of the back, pelvis, and hips. First, we are going over cat-cows. You are to start on all fours, hands directly under shoulders, and knees directly under hips. Take a deep breath in, dropping your belly to the ground, pinching shoulder blades together, gently down and back, and looking up. As you breathe out, bring your mid-spine to the sky, allowing your tailbone and head to come closer together. Follow this flow using your breath 5 times in each direction. Breathe in, look up, tailbone up, breathe out, head and tailbone to the ground. Next, we have pelvic mobilization in the form of hip circles. The lumbar spine should be in neutral, maintaining its slight natural curvature. Move as if you have a pencil in your belly button and the tip of the pencil is hitting the ground. Begin to draw small circles on the floor. Circle in one direction 5 to 10 times, slowly and comfortably creating larger circles. Repeat in the opposite direction as well. Feel free to rock through any stiff spots, for example, a 4 to 5 o'clock, or to hold and pause and breathe in any rigid areas of the circle. Your physical therapist can individualize this for you. Next, we take this mobilization into a wider stance for a deeper stretch. Repeat the circles in a clockwise and counterclockwise direction 10 times. Now for our pelvic tilts and clocks. Seated tall on a physio ball or a soft chair with your hips and knees at a 90-degree bend. Imagine you are seated on a clock face and rock from 12 to 6. Imagine your pelvis is a bowl full of water. As you rock forward, you tip some of the water out towards your feet. Then rock back, tipping some water back at 6 o'clock. Repeat this several times. As little as 3 will do it for you. Then rock 3 to 9 o'clock, side to side. Rock your clock then in a clockwise and then counterclockwise direction 10 times. You can also complete this in a wider stance. Complete that same series you just did, 12 to 6, 5 to 10 times, then 3 to 9, 5 to 10 times, then circles, clockwise and counterclockwise, 5 to 10 times in each direction. Now we are going to work on some balance and power with the tabletop using physio ball. You're going to walk your feet out where your knee bend is about 90 degrees and your mid-back is supported by the ball. Drop your bottom toward the ground, then press your hips up. Look to your therapist if you should add a pelvic tilt to this movement. Complete 5 repetitions and work up to 20. You can walk your feet out further, placing the physio ball under your upper back for a tougher challenge. If you do not have a physio ball, you can use a workout bench for a mattress or move to our next exercise, tabletop on table, which is a combination of a reverse plank and a bridge. With control, lower your bottom to the ground and then press your hips towards the sky. These exercises should be gentle, comfortable, and feel good. Always consult a healthcare provider prior to starting an exercise routine, and that's our intercourse mobility prep.